All right, I'm going to get us started. So, for those of you who just joined, thank you again for joining at such a timely manner. Good morning, afternoon, wherever you're at. I appreciate you guys joining us for this CCBHC Implementation Science Pilot Learning Collaborative meeting. We're very excited to be in the rooms with you again, and hopefully this is a helpful session as you both get to update each other on we'll have our partners, our national council leaders, our federal partners, and you guys actually updating us on where things are at. And then for those of you that are tracking, we'll also do some breakout rooms and gather some further information from all of you. And hopefully you get a second to do some peer exchanges as well. So I don't want to take too much time, but I am hopeful that you'll all stop and drop into the chat your name, your organization, your role in that organization. And then if you have been partnered already with a researcher, or if you are a researcher, that you're partnered with a CCBHC, and let us know if you're not partnered. It would be great to get all that information in the chat so we know who is here and where you're at in this important project. Let's go to the next slide, Matt. Just as a reminder, I'm sure all of you are absolutely just stars with Zoom at this point, but just as a reminder, you please use your chat button, your Q&A questions, or your chat, and also know that we are doing live transcript for purposes of dissemination and tracking of the input that you're giving. I also honestly cannot remember if I said who I am. So let me back up for a half a second and tell you I'm Michelle Zabel. Many of you have seen me before in previous webinars that we've hosted around this topic. I'm the Executive Director of Innovations Institute, proud partner of National Council in this initiative around CCBHCs, and also faculty at UConn School of Social Work. So for those of you who don't know us, Innovations is a translational research and implementation center, and we're always happy to be in the space of supporting federal initiatives and partnering with NatCon. So thank you for having us today as your partner in this work. As a reminder, as a disclaimer, although SAMHSA has participated and is leading this initiative, there might be things that we say or do that are not reflective of them. And so just a reminder of that as well. And then I'll come back in a little bit, but Matt, if we could go to the next couple slides, I do want to stop and hand this over to my colleagues at National Council for their own introductions and framing of the effort that we're involved in. And I'll see you in a little bit. So.
Thank you, Michelle, and welcome everybody. Good afternoon. My name is Flannery Peterson. I am a director at the National Council for Mental Wellbeing. I know I'm a new face for several of you, but you will be seeing me both for today's session and the next Learning Collaborative session in September. I am joined today by my esteemed colleagues, Amanda, Whitney, and Camille. They are essential to the execution of today's session, as well as the implementation science pilot initiative in general, but they'll probably mostly be in the background, so give them a shout out when you can later on in the chat. I'm sure they would appreciate it. Just to kind of reframe who we are and our role in this, the National Council supports the Implementation Science Pilot Initiative as the CCBHC State Technical Assistance Center. In this role, we represent and convene CCBHC grantees and support them through coordinating technical assistance requests in partnership with UConn Innovations Institute. We also provide group-based learning and TA activities such as today's session, and oversee and maintain the database of participants as projects. Matt, we could also go on to the next slide. I forgot to mention that earlier. Oh, okay, so here are some of today's learning objectives as well. So we'll be going through grounding and updates from SAMHSA and NIMH and NIDA, review how to find resources in past sessions from the ISP, align on common themes from previous listening sessions and align those to relevant resources, and discuss where research dollars can be found beyond NIH. We'll also take an opportunity to have breakout discussions to plan for strategic peer learning in session 2, where we'll be able to hear from all of you. Next slide. So in addition to National Council and our federal partners, we are working with UConn. Thank you, Michelle, for the great intro, and MPHI and evaluation efforts. Additionally, for those of you who might need a reminder, implementation science is really a fundamental pathway to support removing barriers and promoting facilitating factors related to implementing evidence-based practices across clinics in the public sector. As such, SAMHSA, in collaboration with NIMH and NIDA, launched the implementation science pilot to facilitate the adoption, scaling, and sustainment of evidence-based practices in CCBHCs. This practice-based research initiative encourages research and practice partnerships between CCBHC grant recipients and researchers to draw on implementation science to advance the quality of clinical care, behavioral health system performance, and health outcomes for the patients being served. And with that, I would like to hand it off to our federal partners over at SAMHSA, NIMH, and NIDA to say a few words.
Thanks so much, Flannery.
I'll hand it off to you.
Thank you. Thank you so much, Flannery. And thanks to the National Council for all their support here, and to all of you for engaging in this pilot, given everything else that you have going on, all the important work that you do. I just want to say a few words. I'm Nima Sheth. I'm a senior medical advisor at our Center for Mental Health Services, along with Mary Blake and others, part of the core team that conceptualized this pilot and have been kind of overseeing it from the federal perspective. I'm a psychiatrist by training with a public health background, and as such, with a lot of kind of background and history and practice, know how important the value of implementation science is to providers and practitioners and our patients. And so, I want to say a few words about, I know Flannery gave an overview of what this pilot is, and I know you all know what the pilot is, but I just want to review a little bit of the kind of original purpose of the pilot and then what success looks like in this pilot. So, the original purpose was to be able to have more practice-oriented research, right? So we know that some research is great and has a lot of kind of practice-based orientation in it already and is being informed by practitioners and clinics, but we know that often there's a dearth of kind of the right samples and populations and communities that are being studied in terms of diversity and equity, often within research. And, as CCBHCs being in the public sector and the important work that you all do with regards to equity and serving, under-resourced populations, we wanted to make sure that to really have an opportunity to connect investigators specifically to the work that you all were doing and have CCBHCs inform a set of research studies over the course of, the next few years. And the focus on implementation science is there to really assist with implementing EBPs, right? Because we know that that's a core activity and requirement of the CCBHCs, but how do we really provide support for that? Yes, there's technical assistance, but how do we try to look at real implementation issues, including things like adaptation, staffing, education, training, resources, around the implementation of evidence-based practices, and how do we really give voice to practitioners that are trying to implement these EBPs? And then more, from the research end of things, how do we then make those things more public to other practices and investigators, so that this, we can move the needle and push the field forward. So that was, the original purpose is really to improve practice and to improve patient outcomes through utilizing implementation science studies and frameworks. So that was the original purpose of this study, in addition to, or of this pilot, in addition to what Flannery had, has mentioned with the overarching goals. The other, I think what success looks like here is, I just want to say it's not one thing. It doesn't mean that everyone here has to have, everyone that has opted to be part of this activity is going to end with a successfully funded study, that is launching. I think it's everything from learning about implementation science, its utility, practice-oriented research, being engaged in a learning community, learning from other colleagues that, might have engaged with a partner, understanding kind of the utility of research in practice and how it could contribute to improving practice and patient outcomes, quality improvement, right? I think it's really a spectrum in terms of what success looks like. And so I don't want anyone here to feel like the only end result of success is to end with a partner with a successfully funded study, let alone an NIH, funded study. But we want to support each and every one of you to get to that point, if that is something that you would, of course, want to do, and we want to see you being able to get to that point as well. Also noting that the myriad of investigators are also outside of the NIMH and NIDA, circles, so to speak. So there's folks within your own, and I'm sure this comes up in your technical assistance, but folks within your own circles, within other academic circles you might be involved with, other research grants, other foundation grants, that you all might decide to apply for, evaluators you might be working with, and all of those are equally important to us. Despite the fact that this is a partnership with NIMH and NIDA, all of those investigator partnerships are really valuable to us, and we want to lift those up. So that's a little bit about, the pilot. I want to say a little bit more on SAMHSA priorities around implementation science. Increasingly in the past few years, our center director, Dr. Anita Everett, has, valued more and more implementation science. And it's for some of the reasons that I mentioned earlier around helping us understand impact, how far we're moving the needle with our services, and then really how to help grantees and practitioners improve outcomes, right? And I think if we're really going to do that, having a focus on implementation science is really important. In doing that work, we really have prioritized these partnerships with NIMH and NIDA. We just have, I can't say enough about this partnership. We have met, we meet even now, sometimes almost every week, whether it's around this initiative or other initiatives that we're working on together. And really those that have heard about this particular pilot have talked about the kind of federal collaboration behind it as being somewhat novel in the way that, it was done. And, the NOSI that came out through NIMH and NIDA supporting the study with the allowable activity that was put into the funding opportunity in the CCBHC NOFO was really, is pretty novel. There has been a lot of things like that done. And so we really value those partnerships. And I know our NIMH colleagues can be here, but you're going to hear from NIDA here in just a little bit. And they really have said that they really do value, practice, right? The programs that are doing the practice, because to them, that is like ultimately with the feedback around how the research can only go so far as the practice goes, right? In this realm. And so they really value those partnerships and value the feedback and the collaboration. And so I think Dr. Freed and others from NIMH will come speak at a future session with you all as well to express support and, be available on an ongoing basis for technical assistance and such. So we just want to say that there's been an increasing priority on this. There's one program that I would like to call out that should be being awarded soon. The applications have closed, but we, for the first time, have come out with a new national center called the MDIS, which is the MHDIS, so the Mental Health Center for Dissemination, Implementation, and Sustainment. And implementation science is a big focus there. And so this is one national center, kind of the first of its kind at SAMHSA within a Center for Mental Health Services that focuses on implementation science, but it is a technical assistance center that is going to be able to help and support all of our grants. And those include our services grants, our technical assistance grants, and our infrastructure grants, because this is a TA center that helps with the process of change management and process improvement. And so they're going to be supporting folks, in building kind of core resources around continuous quality improvement, implementation science, contextual determinants of implementing EVPs, marketing techniques. And they're going to be developing these resources, and there's going to be 5 kind of regional sub grantees or kind of 5 regional partners that will cover 2 regions each to give more hands-on technical assistance to any and all of our grantees, and partner with other technical assistance grants and contracts to ensure that they then have the resources they need with regards to process improvement and change management to provide the TA that they need. So this is going to be a far-reaching technical assistance center, again, first of its kind, with a real focus on implementation science. So we, just want to say that that's really, really exciting. Also, in this last year, a year and a half, there have been new, Dr. Fried will talk more about this at the next session, but our series funding that is launched off of the implementation science pilot, that is more sustainable funding for projects just like this that have been developed. So, a step above the notice of special interest. And there also has been a notice of special interest put out in a child-focused and school-based implementation science realm. So based off of this, another NOSI was also modeled, and we're looking at in the child space with regards to school-based mental health and implementation science. So, this is really, you all kind of were the first to engage in this, and it really has taken off, and it really is being scaled. And we just really want to thank you for all of the work that you have put in, despite everything else that you are doing, the fact that you're taking the time to do this. And we hope that you continue to see value in this and really, really want to support you in this endeavor through and throughout. So that's what I'll say. I'll end my remarks there. I know we have a lot to cover. I will pass it over to Tisha Wiley from NIDA.
Thank you, Nima. Hi, everyone. I'm Tisha Wiley. I'm the Chief of the Services Research Branch at the National Institute on Drug Abuse. And I really want to thank Nima and the SAMHSA team, as well as the National Council team, but really our colleagues too at the National Institute of Mental Health who conceptualized this. They brought us in as a partner. Speaking from the NIH perspective, of course, we fund research and we have lots of mechanisms, and Dr. Fried and his team have really led efforts to put out solicitations. But I just want to speak to sort of the larger goal, and really excited to even have the opportunity to observe all of you as doing this work as part of this learning collaborative today. Within the work that we do at NIDA, we are always very interested in the science to service dialogue and making sure that the research that we fund is really relevant, has the ability to be scaled and sustained, and address key issues of equity, and really have that true connection to practice. These are things that we value in all the work that we do. So, we encourage all of you to continue building these partnerships, whether there are NOCs out there or not. Please come to us with this kind of work, these kinds of opportunities where we can help support these bi-directional feedback between researchers and people out there in the field doing the hard work to deliver services that can really improve people's lives every day, and making sure that we can really ensure that our research investments are moving the needle and helping do that. Part of the whole impetus for the emphasis on implementation science, I've been at NIH for 14 years, and the entire 14 years I've been here, I've been working on various implementation science efforts. And a lot of that is driven by this observation that as we have investments in clinical findings, that it takes a very long time. 17 years is often cited as a statistic of how long it takes an innovation to make it into daily practice. And I view the role of the branch that I lead at NIDA as every day in all the work that we do and the funding that we put out, the initiatives that we design, really trying to change that, reduce that lag, and really build that science to service pipeline. And the only way we can do it is by supporting all of you to have opportunities like this, to have meaningful dialogues with your research partners, and then pathways where you can receive funding to continue that work. So I want to also acknowledge Dr. Sean Lynch, who is on the call as well. He is our program official within our branch that has been the point of contact for these NOCs that we've put out with NIMH. We take a lot of inspiration from the work that our colleagues at NIMH do, but I'm just really grateful to have the opportunity to be part of this initiative. And thank you all for all the work you do. And please feel free to reach out to Sean or I As you think about potential NIH funding, we're always happy to give you advice and coaching about the best pathways to navigate that process. But thank you so much for the work that you do. And I think with that, I am turning it back over to
me.
you. Great.
I'll take it.
Thank you.
Yeah, I want to thank you all for coming and providing that context, and really, honestly, for digging in and finding ways to support the field in really moving these questions forward and sustaining implementation. So thank you to SAMHSA and NIH, both the Institute of Mental Health and Institute on Drug Abuse, for the leadership in this space. It's very, we're all very grateful for it. I also wanted to so now I'm going to pivot us just a little bit, you guys. So a lot of you have attended sessions that were previously hosted by National Council and facilitated by us. I wanted to just take a minute and remind everybody of the resources that are available, so that as you have new people you're engaging with, or you might have some turnover, or you just need to go back and remind yourself what it is we're doing here. If we go to the next slide, Matt, that'd be great. You are remembering what is in the National Council's website and data systems to support you in doing this. So 4 of the sessions that I just want to remind you about happened, it's probably been a year ago at this point, but all of it is still relevant. So just because it's a year old doesn't mean it's not very usable. There was hosted sessions on introductions to actual implementation frameworks and developing a research partnership, organizational capacity and readiness for implementation with a research partner. And I think that one is particularly for the CCBHCs on the line, a good one to pay attention to, in the sense that there were really good questions and dialogue about, the expectations for you to engage with a research partner, and then what you can expect of your research partner as well. And so I'd encourage people to review that one again. Establishing continuous quality improvement systems with fidelity and quality monitoring, and then implementation strategies, both selecting and tailoring strategies to improve outcomes, which was led by our colleague Allison Metz, who leads many of the implementation efforts across the country. Okay, the next slide is a continuation of the additional resources. These are all things, again, that National Council has on its website ready for you to use. Some of them are pulled over from NIH, so you can also find at the bottom of this page, you see the NIH grant process and NIH peer-reviewed live mock study sections. Those are for if you're, as a CCBHC, preparing to work with a partner who is not necessarily, has an extensive NIH background. Those are really good places for people to start, related to if you're thinking about an NIH application. But we also have resources on there about the pilot program, the CQI processes, building and trusting relationships. They mirror nicely, they pair nicely with the webinars I just kind of asked you to take a quick look at again. And then right in the middle of the page, the implementation science pilot and orientation for investigators is also a really good one to disseminate out to folks if there's as you're engaging, there's questions about what is this, why are we doing this, and what is it. So I think it's all of these resources are probably things you might want to stop and just go back and look at real quick and see how you could use them. And then the next slide is our attempt to take what you participated in terms of a conversation with SAMHSA about what is working and what else you still need. So that session that you hosted with that SAMHSA hosted with you wasn't necessarily to create a technical assistance plan or a series that would support your efforts in this area, but we were trying to turn it into that a little bit. So there are 4 things that we really heard out of the notes from those meetings. One was that so there are moments where research partners are not really understanding what a CCBHC even is, what the purpose is, what the initiative is in the country to stand up CCBHCs. And so there is a webpage on the National Council's website about what a CCBHC is. I would encourage people to really use that. I would also say if there's additional information that you feel like needs to be tweaked or oriented for this particular project, please just let any and all of us know that. We're all here to like create materials that are helpful to you and explaining this and bridging the gap so that you can move forward in your efforts in this space. And then this came up a lot during the initial webinar series, but just the capacity to talk about this pilot overview project with potential research partners. And so again, there is an actual document on the website. The links are in this PowerPoint, which you'll receive, related to the overview of expectations of your research partner and of the CCBHC. It pairs nicely with the webinar that I mentioned earlier, but it's a document that I hope would be helpful to you. And I'll stop at this moment and just ask if people have created documents for themselves or language that you like that improves on anything that we've got in the site, then please just either drop it in the chat so your partners here have links to it, or send it on to us, and we're happy to integrate that or organize it in a way that is beneficial to you and your colleagues. And we thank you for the work you're doing, so we'd like to be able to use it and push it out to support your peers. The other main question that seemed to come up is if not NIH, then what? And there are some basic documents that are out there that are really bent towards researchers when they're starting out in their research careers. But one of them that I'm providing for you here is just 100 places to find funding for your research. So it's a whole list of philanthropic approaches, NIH, government approaches, ways to think about embedding your questions into pre-existing funding, whether that's through a research center of excellence at a partner academic institution or all kinds of things, but that's there. And then I also gave you again the NIH grants and funding, which is a walkthrough of how NIH would think about the different study sections depending on your questions and et cetera. And then I don't think we can be anywhere in the field where we're talking about innovation and new expectations and efforts to push the work that we all do every day forward without really talking about workforce issues that are out there, whether that's staff turnover, capacity building. And so that we've provided you with actually SAMHSA information on addressing burnout in the behavioral health workforce through organizational strategies. And as we move into the next section where we do breakouts, it'd be helpful to hear from people as the breakout sessions are organized for you to give us feedback on what else, what are topics that would be helpful, whether those are documents or webinars or peer-to-peer exchange opportunities that would be helpful to help you kind of cross the finish line in organizing your partnership, defining your question, organizing your grant application, submitting, and successfully receiving the support that you so deserve to have as we push through this pilot project. So hopefully some of those things are helpful. There are things you've received previously, but just encouraging you all to stop and remind yourself of what is available and push that out to the additional team you've probably surrounded yourself up to focus on this effort. If we could go to the next slide, that'd be great. I do want to stop and take a minute and let your colleagues talk to you. So I'm hoping that the community health resource colleagues that are who have organized themselves are ready to talk for a minute. I don't think we have you pinned, so if you could come off mute and video and show us, then Matt can ping you. And the goal here is that you guys talk to your colleagues a bit about how you organized your research partnership, or what you're looking at in terms of funding, how you're intending to apply, have you applied, and what has happened. I know a little bit about what has happened, so I'm looking forward to this. But if we could transition from me over to the CHR people, I would really appreciate it.
I am having trouble with my speakers. Give me 1 minute. I'm just setting it up.
Well, how about I do this for you while you're playing with your speakers? I see Lisa came off of on camera. And so how about we move to Nebraska and let you talk about same questions, just hoping you can give people just a sense of what you've done, how you've done it, where you're headed, and how it's all working out. And then we'll circle back. Okay? Thank you.
Sure. I'm Lisa Pitlick-Zillig. I'm from the University of Nebraska Public Policy Center. We're working with Lutheran Family Services in Nebraska. They have a CCBHC, and well, they have more than one actually. We reached out to the University of Nebraska Medical Center for partnership with us. So it's a double partnership. So LFS will be partnering with us and with UNMC. Our UNMC partners had a lot more experience than we did in implementation science in particular. But since we were kind of forming a new team, they also had more experience than us in NIH funding. Specifically, we had prior NSF funding, but not NIH funding. So working with UNMC, as we kind of looked at the goals, and our main goal was to help Lutheran Family Services look at their implementation of the CHI framework in terms of integrating more physical health measures into their behavioral health processes. And so they're in the process of implementing that across their sites. So we discussed this with our UNMC partners, and we decided, given that we didn't have a prior experience working together, we ought to probably not go after NIH funding like right out of the gate. And they knew of a smaller amount of funding through internal funding through UNMC's IDEA CTR. CTR stands for Clinical and Translational Research. That was particularly for partnership building. So we proposed some initial research questions around understanding how Lutheran Family Services is already implementing the CHI framework in their work, and comparing across a couple of sites, one rural, one urban, and one site that has not started that sort of best practice implementation, to try to understand some of the barriers and facilitators of that implementation, with the hope of getting kind of some pilot data that then could both show to NIH that we're building a partnership, that we're succeeding, as well as using the data for that quality improvement and to plan an NIH grant proposal. So we're struggling a little bit with getting off the ground, as there's been turnover in the team. And also just timing between summer travels and the start of the grant, and also just the timing of like NIH proposals. I think there's a deadline for proposals in October. We won't have data in time for that. Maybe we will in time for February. And just, all of us kind of talking across our disciplines, our applied disciplines, our social science disciplines, our specifically implementation science disciplines. That is also a challenge to get the terminology and stuff akin, but happy to answer if I didn't cover everything, but hopefully that's kind of a short intro to what we've been doing.
Yeah, I appreciate it a lot, Lisa. And if people have questions, please feel free to drop them in the chat, and we're happy to call on you. I do think that, I should let Grika actually speak, because it's a similar story, and I do think it's one that a lot of CCBHCs can lean into. So is your sound working now, and are you able to talk a little bit, Grika?
Yeah, it's working now. I hope I'm audible to everyone.
Yep, we can hear you. You're great.
Good. So my introduction, I'm Gorika, and I've been with CHR for like over 3 years, and have spent the last 4 months as an evaluator for CCBHC grant. And it has been a fantastic learning journey, and I'm fortunate to be part of a highly experienced team. For the ISP project, we partnered with Dr. Megan and her team from University of Connecticut, who brings in immense knowledge of CCBHC grants and NIH. How did we approach? So to approach the selection process for funding mechanism, a research partner sought internal funding and considered a seed grant from the University of Connecticut. This was a good fit for our project because the goal of the seed grant mechanism is to cultivate new partnership between UConn staff and outside community agencies. The grant facilitated collaboration among faculty and staff from UConn School of Medicine, UConn School of Pharmacy, and CHR. Since it is an internal grant to UConn, there is a quicker turnaround for funding preliminary work in preparation for a larger NIH grant submission. This fund would allow us to compensate participants for interviews, cover some of the professional transcription services, and reimburse mileage for data collection, and to also to cover the time for CHR data analysis staff to extract and analyze EHR data. Coming down to the challenges, the seed grant typically offers limited financial support, which was insufficient to cover researchers' time on the project and also to hire additional staff. Another one would be the original notice of special interest by NIH is set to expire, and this is a concern as well, which was brought down by Megan, to expire in May 2025, and with most of our main grants mechanism ending in February 2025. So this uncertainty about whether it will be extended impacts our planning for a larger funding opportunities. To overcome the limited financial support, we will be maximizing the available funds by prioritizing essential activities and leveraging existing resources. And our current status for this funding journey is we have received the funding, and it was like very recent at the end of July 2024. And our UConn partners are currently assembling IRBs. We have a scheduled kickoff meeting for our with our partners on August 29th. So that is it, and I'm glad to share my experience here. And if you have any question, feel free to reach out.
Thank you both. I mean, it's interesting, right, that you both ended up turning to internal university funding as a way to seed partnership development and organize yourselves for a greater grant application. And so I don't know if you want to comment on that, but as a university person, I do think that others should think about that if you're not quite ready. And I saw in the chat that we did have a couple of people who are ready to go with R01 or have submitted that way. But if these are new partnerships, I think I'm hearing from both of you that these kind of seed fundings that most universities have available to their faculty for the purposes of creating community partnerships seem like I hear all the concerns and the limitations, and that you are absolutely right. They're not a lot of money. They're just a little bit of teaser money for people. But it is a way to get those relationships organized. And I wonder if either or both of you want to comment on that. I mean, the ease of getting those grants is it's a lot easier than going for an NIH grant to begin with. And if you don't have the relationship established, I'm thinking this is something we maybe want to encourage others to think about. Lisa, do you have a comment?
Yeah, and even though it's not a lot of money, it's certainly better than zero. I mean, because that's what we were looking at before, was like, oh, how do we get a grant written with zero money? So being able to give our partners some money for the extra data and stuff when we don't know if it's going to actually pay off into a funded grant, it does at least reduce that risk. Like, we know we're going to have some benefits. And it was actually very encouraging for me to hear on the call today, hey, success isn't necessarily getting that NIH grant. You know, success can be moving quality of improvement forward. It can be building understanding and so on. All of that I found very encouraging. But yeah, it was also very encouraging not to have to, as a soft money researcher myself, be developing something with zero money.
Yeah. Yeah.
Or with zero offering to our partner.
Yeah, which has come up multiple times for researchers as they thought about partnering. So again, it's a nice thought for people to pay attention to. If you've got a university partner, that really almost all of the research universities out there, at least, right, have something similar to what you're talking about from Nebraska, what you're talking about from UConn. Rika, I thought it was really important also what you said about the time frame limitations. And I don't know if you have anything else you want to comment on that, but I do think that's a good pullover for internal discussions between SAMHSA, NIH, and National Council that, you know, they're committed to this. So I'm sure they've got solutions around that area, but it's an important call out. So thank you for that. Yeah. Do you have any other thoughts?
Yeah, I mean, it was brought down by Megan, and I would surely, because this is a concern, since if they have to file in for more funding, they need to have their so negotiating with on those, navigating those uncertainties is what we are struggling currently.
Sure.
But I think I'm sure they are putting a close eye about the grants and the dates, and I think we should be there. I mean, I would bring in Megan into this, and maybe she would be able to talk more about this one.
Okay, great. Okay, my friends. So we want to take a minute. First off, thank you both. Thank you for being willing to jump in and talk a little bit about your story. It was interesting that your stories really are very similar, so I appreciate it very much. We want to go to breakout rooms now. And so the way these have been assigned to you is that there's enough of you that are partnered that there's 2 breakout rooms for partnered and then 1 breakout room for pre-partnered. And you will have a facilitator, if not 2, in your room, a note taker, if not 2, in your room. And we have a series of questions that, you know, are intended really to just facilitate your input. And we're doing this for a couple reasons. One is that anytime, obviously, we do technical assistance or invest in creating things that, you know, require your time and your energy to sit in meetings or produce things, we want to make sure it's on point for where you're really at and what you really need. So this is your chance to really talk about what it is that would be most helpful to get you across your finish lines of engaging fully in this project, but also the approach for that. Is it mostly peer support? What is it that's going to really be the most helpful for you? As a reminder, there was 1 or 2 sessions we did where we actually pulled in some pretty heavy hitting NIH researchers. They actually looked at people's aim statements and gave some TA around if you are going after an NIH, NIMH grant, like what you could do to improve your application. So there's all kinds of things you guys could be thinking about in terms of the type of support that might be helpful. So we're gonna take a minute and move you into rooms. You're gonna fly around into those rooms. So we're back and our group needed more time, so sorry. I'm going to do a really quick report out for us and then I'm interested in from the partnered groups what the thinking was. So I was in the pre-partnered group. The truth is we spent a bit of time needing to just baseline expectations of the actual project and answer some questions. So Mary Blake, thank you for playing that role because there's still a bit of confusion about what I don't think there's confusion around the steps. I'm looking at the members from my team that I can see. I don't think there's as much confusion about the steps as there are, like, if we didn't go out externally and get an external researcher, but we did things internally, does that meet the bar of SAMHSA's and NIH's expectations? And so we spent some time talking about what SAMHSA and NIH has done to support this initiative, versus do you have to do all those things, right? So we spent time doing that. And then I think and then we ran out of time and Matt flew us back into the big room. But the one thing that came up is just the need to have more examples and to hear from people who've gone before, and then also have folks from both NIH and SAMHSA maybe give some specific responses to after listening to what project ideas are there. Like, it's one thing to put it into the form, but does this project idea merit interest from external funders, right? Is that fair? I can see Sunny, and she's the last person that talked. So is that a fair reflection of kind of the point we got to in our group? Yeah. Yeah, trainees. Yeah. So before we flew back into this room, we were talking about the just the kind of strategic difficulty of finding the right research partner who's interested, that might have some base funding, and what are the options around that? We had examples earlier from Nevada and Connecticut using what are, small, like seed funding from their universities. There's also trainees or postdocs. Like, there's ways to think about it not being as heavy a lift. So that's really as far as we got. So I can see you, Johanna. How about you go next?
Yeah, for sure. Thanks, Michelle. So we were a group that were already partnered with researchers, right? And so I think the first theme is that because of that, from sort of the list of topics, we gravitated more towards interest in sort of 1 and 5. So how do we do more new funding sources from the work that we're doing right now? And then a lot of interest in the question of capacity, both really how do you use the capacity you have, whatever that is, and then how would you grow capacity in this? We talked about both things that we're interested in covering in peer exchanges, and then also structure and the ways we could be partnered to learn better. And so there's a lot of interest in realizing that the journey through this process of partnering with a researcher changes over time, and that readiness work takes a long time. So it might be helpful to be talking to peers who are also in a readiness stage, creating shared vocabulary, that type of work, versus being somewhere else in the process. A lot of interest in quality improvement, right? So sort of that rapid cycle application of what you're learning. Okay, we learned it as we're studying it, but then how do we embed that learning within organizational culture? And blew out a little bit wider that's sort of applicable TA across the work as we're doing CCBHC implementation. And then we talked quite a bit about that, like what's the best peer match? So get us in small groups where we can share exactly what we're doing around a topic, and then have a ton of back and forth peer Q&A. While we're doing that, it's helpful to be mindful that single location provider CCBHCs have very different organizational culture and implementation strategies than those with multiple locations or within a really deep system that might have its own levels of bureaucracy. For those that are working, within an internal evaluation team versus working with a partnered university versus an NIH funder. So like our funding source might be helpful to think about in how we match. And then there was one other really great thought I wanted to say, which I can't remember it. So my group can chime in if there was something else that I might have missed.
Is there anything from Johanna's group that people want to add, clarify, expand on? You all think she did okay? That's what I see. Amanda, was it you? Should I be calling on you or Flannery, or who?
Either one of us, but I'm happy to chime in.
Go ahead, Flannery.
We're also in a breakout room. Some of the similar themes that Johanna mentioned just now, a lot of interest in prioritizing, talking about managing capacity challenges. A lot of people identified with that topic and hearing what other people are doing to manage, kind of building off of the capacity challenges. Also, how do you navigate next steps if funding is not awarded, and when you're also looking for additional funding opportunities outside of NIH, kind of reflects back on the capacity challenges, just depending on the size and of each organization, the individual capacities to really submit those applications and how much time and effort goes into that process, and knowing when it's time to stop or there's still ample opportunity to continue. I think additionally, building strong relationships and partnering with researchers, I think those kind of go hand in hand, and exploring how that is done in terms of best practices amongst peers, and then also acknowledging that, both kind of, even if you are partnered within the same agency, that doesn't necessarily mean those departments always work together and understand what the other department is doing. So just having some best practice and conversation around how do you understand researchers and how do researchers understand CCBHCs. And I think that, kind of encompasses both the partnering and the building strong relationships aspect.
Great. Thank you, Flannery. Hey, from Flannery's group, is there anything people want to add, expand on? Or are you all giving her thumbs up too? Okay. All right. Well, we are very close to the end of our session, and I'm hopeful that you understand how appreciative we are. We know that this, certainly for the pre-partnered group, there's still some additional questions and pieces of information we can probably get you to help you as you move through the next steps. And we look forward to seeing you in the next session where we'll take all of this information that you provided and design an opportunity where there's exchange and information that you've requested and so on. So I want to thank you for all of that. If you've got thoughts you want to add into the chat, please do that now. And then Matt, as we move to the next slide, just a reminder that that next session that I keep referencing is Thursday, September 5th from 2:30 to 4. We will have NIH here. And so NIMH here. So, I would encourage you to come with questions in that arena as well. And I'm going to try and get you out of here with a couple minutes to go. So please complete the brief poll that Matt is handling somehow miraculously, and give us your feedback, because we'll use all of it as we move towards the next session's design. And I thank you for just coming and learning and communicating with us and helping us really think about how this should look for you moving forward as we really work to strategize and support you without taking your important time. So thank you.